we are actually doing Rasayana therapy for geriatric people. It's actually a procedure for slowing down the aging process. We have chosen the name knowingly that this is a difficult thing, but we know that we can do it.
If there's one thing that the world has collectively learned over the past few years, it is the importance of good health. While modern medicine got its due, people also began increasingly turning towards traditional medicine for its therapeutic benefits. Today, we speak to the Chief Physician, Dr. Madhav Chandran, at Rasayana Ayurveda Center, a state-of-the-art destination for healing, set right here in God's own country. I can attest to the effectiveness of the doctor's healing touch at Rasayana. My grandmother, not too long ago, was taken in there on a wheelchair, unable to walk, and in a few weeks' time, she walked out of there healthy and happy. So, hello, Dr. Madhav Chandran. So, let's start off with the name. What does Rasayana mean, and why did you pick this name?
Neha, thank you for the question. This is a very relevant question for my organization. 8 specialties in Ayurveda, and Rasayana is one of them. Very less people are venturing into Rasayana because it is a bit difficult to do, actually.
Okay.
So we would like to be the pioneers in Rasayana therapy because it is the most effective therapy in Ayurveda. We are actually doing Rasayana therapy for geriatric people. It's actually a procedure for slowing down the aging process. We have chosen the name knowingly that this is a difficult thing, but we know that we can do it. As per Ayurveda, Rasayana is Labhopayo hi shastanam rasadinam rasayanam. That means there are 7 types of dhatus in the body, tissues in the body, and Rasayanam is the procedure to nourish 7 dhatus. So that is called Rasayanam. So we are doing that special treatments, and so we chose the name knowingly, and we took the challenge.
Okay, that's great. So you had mentioned to me earlier that there's a difference between biological aging and chronological aging. Can you please describe this and tell us what are the factors which probably increase your, this biological aging? Let's speed up.
Yeah, chronological aging is normal aging due to the everyday we age. That is just, we call it chronological aging. But biological aging is a bit different. Biologically, our cells are also getting aged day by day, and they die out, and new set of cells come out. So the length of healthy cells will be reduced due to various external issues like radiation is one. Then the climatic changes, the pollution, then food habits, especially food habits is a very important factor. Due to all these things, our aging, the cellular aging will become faster. For example, a 30-year-old techie. It is a very good example. A 30-year-old techie will be, chronologically, he's only 30 years old, but biologically, when you look, he will be maybe 35, 40, like that, because of the activity, his work. He's constantly exposed to radiation. He's sitting for 12 to 14 hours a day. Then even after that, he's going back to his house and again doing chatting and all those things. So continuously he is being exposed to radiation, and the food habits, fast food, is a very big problem in such people. So the digestion is completely in disarray. That is also a problem. The aging is very fast in such people. They don't even exercise properly. Just immediately after food, they will be lying down on the couch and doing the watching it film, and after that immediately going back to meetings. Especially when you work from home, it is very, very difficult. So you
Correct.
don't have a specific time. So due to all these things, aging of the cells will increase. I think now it is clearer that what is chronological aging and biological aging. So I would like to do at least that biological aging should be equal to chronological aging. Now it is not happening. People are getting older very fast. Maybe the elderly people will be much younger biologically than young people. So that problem is there. As an Ayurvedic practitioner, I am having 26 years of experience. I was not only into practice, I was doing practice. Along with that, I was into research. I was working with Tropical Botanic Garden and Research Institute for a very long time. Then after that, I was at the head of research and development of a very reputed R&D unit of a reputed manufacturer. So after that, I decided to start my own hospital because I wanted to take this challenge. I was always obsessed with geriatric and Rasayana. So I thought I will take up this challenge and do my bit for the world, for the community.
That's amazing. That's wonderful. Okay. So just tell me a little more. So most hospitals now, they focus on care for like younger and healthier people, to only get them to a better state of health. But your focus is on geriatric care. Do you have a specific reason for this and any like numbers to support this?
Yes, I have specific reasons. There are two specific reasons. The first reason is there is a very recent study telling that by 2025, 60% of the population will be past 60.
Okay.
So the number of aging population is very high, and their problems, their diseases will be more prominent in the coming future. So we have to get prepared for that. That is one reason. The second reason is, as I earlier told, the aging of younger population is also very fast. So we have to give some solution for that also. That is why we are focusing into geriatry and in Rasayana Ayurveda Center.
That's wonderful. Okay. Doctor, can you tell me, other than Rasayana, what are the other specializations that you all offer?
Yeah, we are doing all types of Panchakarma treatments. We are doing lifestyle diseases. We are treating lifestyle diseases. We are treating autoimmune conditions like rheumatism, SLE, and psoriasis, etc. But our main specialty, other than geriatry, is post-cancer rehabilitation.
Okay.
And another is preventive cardiology through Ayurveda.
Okay. All right. So can you tell me a little more about, I've not really heard a lot about post-cancer rehabilitation. So can you tell me a little more about this and how Ayurveda could help a person recover?
Yes. The number of cancer patients are growing day by day. also due to the changes in their lifestyle, and also due to the exposure to radiation and pollution, etc., and the food habits. So the number of cancer patients are going up. They are, we are effectively treating cancer patients in the first and second degree of cancer.
Okay.
That is, in the earlier stage of cancer, we are actually getting good treatments, like radiation. There also radiation, and then chemotherapy. But after that, after getting cured of cancer, people are, even after that, people are getting worried about cancer. Every day they are counting. They may live for another 30 years, but still they are counting. The actual risk factor of a cancer cured patient, a cancer cured patient, and a normal patient, normal person, it is same. After curing the cancer, actually he does not have that problem again. But the risk factor is equal for a cancer patient, a cancer cured patient, and a normal person. The possibility of getting cancer again is the same. The risk factor is the same. But what happens? The quality of life of a cancer cured patient is very bad. He's always worried about getting cancer again. Always worried, counting his days every day. And he's always afraid. He's always afraid to do even an exercise, a proper exercise. So there we thought we can intervene and help them. They require help, actually. Actually, somebody has to tell that, boss, you are not going to get any more diseases. Don't worry. You are going to be better. So and we have to plan his diet. We have to plan his food, his activities. We have to plan his medicine. We have to plan his therapies, and we have to detoxify the person. Maybe every 6 months, so that the cancer does not repeat again. We call it apunarbhava chikitsa. Apunarbhava chikitsa is the Sanskrit word for not repeating cancer. So we give the medicine and treatment so that he does not get cancer again.
So is this something that is recorded in Ayurvedic history, like cancer and then post-cancer treatment?
No. Actually, cancer treatment is there. Cancer treatment is well defined and described in Ayurveda. Their Ayurvedic treatments are there, but it is not very effective. Not as effective as the new chemotherapy. But after that, after cancer, the treatments, we do better. We do better than the allopathies. Yes.
Okay, got it. Okay, interesting. So you had also initially mentioned something about preventive cardiology. So from my understanding, that could just entail like lifestyle modification or that something of that sort. So what do you all offer on that front, from an Ayurvedic perspective at Rasayana Ayurveda Center?
It is a very new area. Nobody has ventured into this area. Preventive cardiology, there also the lifestyle comes in. Lifestyle, as you rightly said, the lifestyle comes in. A lot of people, young people, are getting cardiac diseases, and due to their lifestyle, their food habits, their wrong activities. So we help them. We detox a person properly. We help them to reduce, if they're obese, we help them to reduce their obesity. If cholesterol is high, we counter that. If diabetes is there, we counter that. If he's a continuous smoker, we counsel him so that he reduces all those things. Then detoxification is a must for panchakarma therapy is a must for even preventive cardiology treatments. Then changing the body pH is very important in this condition, especially changing from acidic to alkaline body pH. It reduces the risk of getting cardiac issues. So the risk factors are obesity, smoking, then wrong food habits, wrong lifestyle, so we correct all these things, and we detoxify the patient so that the accumulated toxins go out of the body and the circulation gets normal. It is very important. Yeah, when we do the massages, the Ayurvedic massages, we always do the long strokes. You might have experienced that. We do the long strokes. After long strokes, all the energy pathways open up. All the blood circulation pathways open up. Even the lymphatic pathways open up, and that. So the circulation, once the circulation is increasing, then the toxic material accumulated in the body can be reduced, can be actually thrown out of the body through panchakarma. Without that, it is not possible.
Can you tell me about the different lifestyle diseases that you commonly see, and if there's a rising trend in any of these?
Yeah, diabetes. Diabetes is the biggest villain in lifestyle diseases. Then obesity. Obesity is also a big problem faced by the new generation, especially because we are not active, and we eat high calorie food, very rich food we eat, and exercise very less exercise, and stress factor is also there. Big stress, it is there. So all these things cumulatively cause the lifestyle problems. We call it aharam, viharam, vicharam. There are three factors. Aharam is food, your food habits. Food habits can cause stress. If you eat good food, it is sattvic food. But if you eat old food, for example, stale food, or tamasic food like not properly cooked food, uncooked food, all these things can increase the stress in the body, in the gut. So it's a stress factor. So then viharam and fast food, of course. Fast food is also giving a very big stress factor for the body. We don't know it. Then viharam is our activities. We are active, very active people, but we are stressed a lot due to the activity. We drive a lot. We sit a lot. We don't exercise. All these things can cause stress in the body. That is viharam. Wrong activities can also cause this. And vicharam, thoughts. The stress, that is the biggest stress factor. The body and mind are related to each other. If mind gets disease, the body also gets disease. Similarly, if the body gets disease, it reflects on the mind also. So curing both of them is very important. These three factors, aharam, viharam, vicharam, these factors are the real cause of lifestyle diseases.
Very, very true. Okay, so you've stressed the importance of like diet, exercise, and mental health. So like a few days stay at Rasayana, do you think that this actually changes a person's routine habits in addition to the therapies you provide? like over the course of that period when they are staying there, or is there some other function behind them staying there for getting the therapies?
There are more than therapists actually. Therapists normally we start the therapy initially. When the patient comes in, we do the consultation, a long consultation. We understand what all problems are underlying. Then we initially start with various massages. These are to, as I earlier told, these are to open up all the pathways in the body. After that, so that is the preparatory stage. We do all the massages. After that, we do panchakarma. Panchakarma is the detox. There are five types of panchakarma therapies. That is vasti, enema. Virechanam is induced loose bowels. Nasyam, nasal drops to clean up the nasal cavities. Then Raktamoksham is bloodletting, and then Vamanam is induced vomiting. We don't have to do all these treatments in one person. So, especially Vamanam and Raktamoksham and all, we do in certain patients only. We will be very selective in doing panchakarma, which panchakarma you require. So we will be doing that, and after that we go for Kerala specialty therapies like Nyavarakiri, Pilichil and all, so that the to increase the muscle power, to increase the functions, body functions and all. So we will be doing that. Along with that, we will be giving medicines, internal medicines, to increase the body activities. There can be toxins in the body due to the wrong digestive processes. So we have to eliminate the toxins. For that, we initially give Deepana and Pachana medicines. Deepana means to increase the Agni, the digestive fires. Then Pachana is the medicine to actually digest the fires, digest the toxins. These Deepana Pachana medicines. Then we go for Swedana, Snehana and Swedana. That is oleation therapies. That is giving oils inside and outside. Then after that only we do the Panchakarma. Okay, after Panchakarma we give Shamana Chikitsa. Shamana Chikitsa is medicines to stabilize the condition.
Okay.
Only after that we go for Rasayana Chikitsa.
Okay.
So when a patient comes to Rasayana, they can expect all the Ayurvedic therapies, including Rasayana Chikitsa. Then they can expect yoga and meditation. They can also expect very good food, vegetarian, but very tasty food, very tasty. And very hygienic climate and peaceful climate. And we have very good air, very good water, unpolluted water, unpolluted air, and locally collected vegetables and fruits. So I think these things are luxury nowadays. Okay, it is available in Rasayana.
Okay, that's wonderful.
Okay.
So you'll also offer wellness programs. So wellness programs probably for those who are looking for a change of pace and space. Can you tell me about how long a duration of a wellness program only would be and what someone could look to gain from it?
Normally, I advise wellness programs for 7 days, 14 days, and in certain cases, 21 days. But for active, nowadays people are very, they don't have time, very active people. So they come for a weekend wellness programs also. We do that also for 2 days, 3 days wellness programs also we carry out. But I always tell them that more time would be more beneficial for you.
The next thing I wanted to ask is about I have actually seen the infrastructure that you all have at Rasayana firsthand because my family has been there and it's beautiful. So can you tell like all our viewers about what the infrastructure is like and how many rooms do you have? What are the different treatment areas that you all have for them to visit?
Okay. In Rasayana, we have villas as well as apartments. So people come here. There are 12 villas and 8 apartments and 8 suite rooms. People can choose. People can choose in between. Even families come and stay in villas and apartments. Suite rooms we normally provide for single patient. When he comes alone, he can stay. It's a very comfortable stay. Big rooms, two adjacent rooms, like that. So it's very comfortable. And apartments are even better. Apartment, there are 2 bedrooms, one for the patient and one for the bystander. A patient has a double cot, and the bystander has a single cot. There can be AC as well as non-AC rooms in apartments as well as in villas. So villas also are having 2 bedrooms, one for the patient and one for the bystander. Both the rooms are attached. So for the patient as well as for the bystander, maybe a nurse is coming for the patient, so she can use the other bathroom. That will be more hygienic for herself as well as for the patient. So it is available there. Then we have various indoor games like chess, caroms, cards, and all, because people are there. People are staying here for 21 days and even more. So they require some change. So we are providing all these things. Then there is an exercise room. We are giving exercise for the. We are providing cycles for exercise, and as well as for walking also we can provide things. Then we have a walkway around the hospital. It's a beautiful walkway. A rustic walkway, I would say. It is very beautiful with flowers, with fruits and all those things. So people take normally people take morning walks, and it's very beautiful. The mornings are very beautiful in Rasayana with misty mornings. So it is a very beautiful place, and we have treatment rooms and yoga rooms. We give there are dronis for treatments, Ayurvedic treatments, and there are steam baths also available in those rooms, and there are Shirodhara stands also available. We can do Shirodhara also there. And we have yoga room, very comfortable yoga room, very large. At least 20 people can do yoga at a time in that yoga room. And we have a community room where we have dances and other programs for the patients. We have that. People come here from outside, and artists come here and do the programs. We carry out Kuchipudi, Bharatanatyam, Mohiniyattam, then this temple music. That's our only available inside the temple. So they come here and do Edakya music and all those things. So Gita Govindam and all such musics are there. Then this some Chandamelam and all those things used to be there. Drum and all those things are there. Panjari Melam, Pandi Melam and all those things. At times for the patients. So all these things are available. We are not only focusing on the body, we are also focusing on the mind. Only in a healthy body, healthy mind can be there. And when the mind is healthy, the body is also healthy. So we believe in that. We help.
Correct.
So, yeah, that's it.
Okay. Well, I mean, it can be said that, like Rasayana is actually an escape from the city and city life. So can you tell me where exactly is it located?
Actually, Rasayana is situated only 21 kilometers away from Vaitla Junction, Ernakulam, Cochin. And it is 42 kilometers away from the airport, and 26 kilometers away from the 14 kilometers away from the nearest railway station, 14 kilometers away from the nearest metro station. So it is strategically placed, and good roads are coming to Rasayana, but we are inside an estate. Okay. So the atmosphere is very calm, very beautiful, good air, good water, everything is there. And I was surprised when I saw for the first time, when I saw Rasayana, the buildings. I was so surprised that only 20 kilometers away from Cochin, and such a beautiful village. Right. Very, very beautiful, very clean village. One of the cleanest villages in Kerala. It is awarded this village is called Manid. This village is awarded by the as Green Village of Kerala. So we are in that village. It's very beautiful and very strategically, very well placed from the airport, railway station, and bus stand.
Okay, that's nice. So just a extra question: what's on the menu today at Rasayana? Can you give me an idea?
Yeah, actually, today's menu is a bit different. Normally we give early in the morning. We give Kerala breakfast only. Then by 11 o'clock we give juice containing amla and some other vegetables, a juice. That is a Rasayana we are giving. Then during the noon lunch we provide Kerala matta rice with rice bran. Rice with lots of rice bran and lots of curries, different curries, very tasty curries, and sambaram. Sambaram is diluted buttermilk. So that is normal. Then evening we give cut fruits and tea, masala tea, and night we provide chapatis and curry and tawa paratha and all those things. But today it is a bit different because we have a group of Russians here. So we have reduced all the spices much. Otherwise they cannot eat it. So we have reduced it. We are providing soups also, bouillon. Actual Russian soup we are providing. Bouillon we are providing, and these are the today's menu.
Can you tell all the languages that you can converse to your patients in?
I can speak. I can speak Russian also. I speak English, Hindi, Malayalam, and Russian language, and a bit of Tamil also. I understand Sanskrit, although I'm not very conversant in Sanskrit language. But I can understand. I can speak a bit. Yeah.
That's wonderful, Doctor. It was so nice speaking to you and finding out more about Rasayana and what you all offer. And I can actually attest to the fact that whatever you all do there is wonderful and it works.
Thank you, Neha. Thank you very much.